Let's discuss yin-yang theory, the applicable examples in PCM Part 2. For the excess of yang leads to heat and result in yin disease. It refers to the pathogen going beyond the physiological limit and reaching the absolute exuberance degree, all of which belongs to the excess of yang. Due to the nature and pathogenic character of yang pathogen, that is excessive heat, excessive yang results in heat. Predominance of yang often consumes yin fluid within the body and leads to pathological deficiency of yin fluid. Therefore, there is a saying, predominance of yang makes yin suffer. For the excessive yin leads to cold and results in yang disease. It refers to the pathogen going beyond the physiological limit and reaching an absolute exuberance degree, all which belongs to excessive yin. Due to nature and pathogenic character of yin pathogen, that is excessive cold, the predominance of yin often damages yang qi within the body and leads to the pathological deficiency of yang qi. Therefore, there is a saying, predominance of yin makes yang suffer. For the deficiency of yin or yang, this refers to the pathological change of either yin or yang going beyond the normal level. Generally speaking, deficiency refers to yang qi or yin fluid that is the same as the vital qi. The pathological changes generally have the following categories. Letter A, deficiency of yang. Yang deficiency leads to cold. It refers to yang qi deficiency and is characterized by its decreasing ability to move and warm the system. On the other hand, yang qi deficiency causes the body to be easily attacked by cold pathogen. Therefore, there is a saying, yang deficiency leads to cold. Letter B, deficiency of yin. Yin deficiency leads to heat. It refers to the fluid deficiency and is characterized by its decreasing ability to nourish and moisten the system. On the other hand, yin deficiency cannot restrict yang qi and resist yang pathogen. Therefore, there is a saying, yin deficiency leads to heat. Letter C, mutual damage of yin and yang. It is a pathological manifestation of what damage of yin and yang. Yin and yang are mutually connected and rooted with each other. If one side is damaged, the other side will be affected. When yang qi or yin fluid gets damaged, it will result in the deficiency of either side and cause a pathological change of the system. When the yang deficiency reaches to a certain degree, it cannot transform or generate yin fluid, which result in symptoms of yin deficiency, which is called damage of yang affects yin. Vice versa, when yin deficiency reaches to a certain degree, it cannot nourish or moisten yang qi, which result in deficiency of yang qi. This is called damage of yin. Damage of yin affects yang. Both types will lead to deficiency in both yin and yang eventually. Letter D, to guide and diagnostic application, yin-yang diagnosis based on color and luster of the skin. Brighter color pertains to yang, while a darker and gloomy color to yin. Yin-yang diagnosis based on sound of voice and breathing, higher tone, talkativeness, and restlessness pertain to yang, while a low and feeble voice, reticence, and speechlessness to yin. Rough breathing pertains to yang, while shallow breathing to yin. Yin-yang diagnosis based on pulse. From the position of the pulse, tune pertains to yang, while qi pertains to yin. From the pulse rates, rapid beats pertains to yang, and slower ones pertains to yin. And from the shape of the pulse, the floating, rapid, excessive, slippery, and big pulses pertains to yang, while deep, slow, thin, small, and deficient pulses pertains to yin. In diagnosis, the accurate distinguishing of yin and yang is the key to master the root of the disease. 8 principles are the fundamental diagnostic method. Among the 8 principles, external, excessive, and heat syndromes pertain to yang, while internal, deficient, and cold syndromes to yin. To guide the application to the treatment, the basic therapeutic principles of the traditional Chinese medicine are to maintain the balance of yin and yang, reduce the excess, and reinforce the deficiency. The application of yin-yang theory to guide treatment of disease is mainly to determine the therapeutic principle and to summarize the medicinal property. To determine the therapeutic principle for excess of yin and yang, it refers to the excess of yin or yang. It is a case of surplus. When the excessive yin or yang has not caused the deficiency of the opposite party, it belongs to the simple excessive case. The therapeutic principle is to sedate the excess. For example, excessive yang causes heat, and the cooling or cold herbs should be applied to restrict the yang and expel the heat. Vice versa, the warm herbs should be applied to restrict yin and expel cold. The therapeutic principle for deficiency of yin, yang. It refers to the deficiency of yin or yang. Therapeutic principle is to tonify the deficiency. Deficiency of yin often results in the inability of yang restriction that causes the yin deficient syndromes. In this case, it is better not to use the cool cold herbs to expel the heat directly. Instead, the principle of nourishing yin and replenishing water should be applied. By nourishing yin, heat due to the hyperactive yang will be restricted. In the case of deficiency cold pattern due to excess of yin caused by the failure of deficient yang to check yin, to dispersing medicine of acrid and warm nature should be taken to dispel its coldness. But a method of yang supporting and fire supplementing to expel the excessive yin should be applied. According to the theory of interdependence of yin and yang, the methods of seeking yang from yin and seeking yin from yang may also be considered in the treatment of deficiency of yin or yang. When using yang warming herbs, by adding the yin nourishing herbs as the subsidiary, it is called seeking yang from yin. When using yin nourishing herbs, by adding the yang supplementing herbs as the subsidiary, it is called seeking yin from yang. Thank you for your attention.
Under interviewing techniques, we discuss pathological urination. The normal amount of urine should be between 1,500 and 2,000 ml per day. If the body fluids are insufficient or water cannot transform into body fluids and flow downward to the bladder, then the quantity of urine will be changed. Copious urination means copious urine. There will be thirst with abundant water intake. This indicates kidney yin deficiency or the Schalke pattern. And clear and copious urine will mean kidney yang deficiency. Kidney deficiency fails to transform water into body fluids, and so the water flows downward. Scanty urination. If we have scanty yellow urine, that means there is excess heat, oversweating, vomiting, or diarrhea. In this case, body fluids are consumed by heat, or there is loss of fluids from vomiting or diarrhea. If there is scanty and clear urine with edema, this is yang deficiency. Lung, spleen, and kidney yang deficiency fails to transform body fluids, leading to fluid retention. A healthy person should feel the need to urinate 4 to 6 times per day, and either not at all or just once at night. If urinary frequency exceeds 10 times during the daytime or more than twice at night, it may be considered pathological. Frequent urination with urgency, dark yellow urine, scanty quantity would mean a painful urinary disorder due to damp heat. So there is damp heat in the lower burner, leading to dysfunction of the bladder, and the heat pushes out the urine. If there is frequent urination with clear urine, this is usually seen in aged or patients with chronic illness. This is kidney chi deficiency. Kidney chi unable to consolidate, leading to bladder dysfunction. Frequent urination with passage of only small amounts of urine aggravated by stress means liver chi stagnation. Because chi stagnation disrupts smooth flow of bladder chi and thus prevents full emptying of bladder, leading to frequent passage of small quantities of urine. Nocturnal urination means increased frequency. If there is increased frequency at night, often more than 3 times per night, or the quantity at night is greater than the quantity during the day, this is kidney yang deficiency. Kidney yang deficiency that is unable to consolidate at night leads to bladder dysfunction and its inability to store the urine. The color of urine is related to the cause and thermal nature of the disease. Normal urine is light yellow and transparent. Vitamins, medications, and certain foods may alter the color of urine without indicating pathology. Yellow urine indicates excessive heat. Clear urine indicates deficient cold. Turbid urine is damp heat. Red urine means collateral impairment due to heat. Profuse milky urine with excessive water intake is Charcot disease. Under normal circumstances, urination should be smooth and without pain, burning, or feelings of discomfort. Any abnormal sensation during urination indicates a pathological change. Burning pain means pain with urination and feeling of urgency. This indicates painful urinary disorder due to damp heat. Heat injures the vessels to cause pain, as well as stimulates the frequency and urgency of the urinary output. Dribbling urine is dribbling after urination, usually seen in the aged or chronic illness patient. Urinary incontinence means loss of control of urination while awake. The urine is discharged spontaneously. Enuresis, spontaneous urination while sleeping with normal control during day, usually seen in children. Dribbling urine, urinary incontinence, and enuresis are manifestations of kidney chi deficiency. Kidney chi deficiency fails to consolidate the urine and compromises the bladder's function of storing the urine. Also, the kidney loses control over the anterior orifice. Dysuria and anuria, difficulty in eliminating urine, and in severe cases, dripping or a complete absence of urinary flow. So this would mean kidney yang deficiency, and kidney stone or blood stasis would lead to stone or blood stasis obstructing the urinary tract. And then damp heat in the lower burner. Damp heat impairs the functional activity of the bladder chi. Thank you for listening.
Let's now discuss internally generated dampness as we continue with diagnosis according to pathogenic chi. Internally generated dampness is primarily a consequence of spleen chi deficiency or spleen yang deficiency. It can also result from consuming foods, beverages, and medicine that produce dampness or damp heat. As with exogenous dampness, it is important to differentiate between whether there is damp cold or damp heat, as well as where in the body the dampness is. Now let's delve into its etiology. Internally generated dampness can arise when the spleen or the kidneys are too weak to carry out their functions of transforming and transporting fluids in the body. Dampness can also result from a prolonged or excessive consumption of foods, beverages, and medicine that produce dampness or damp heat. Dampness can start as an acute invasion of exogenous dampness that has penetrated into the interior and become a chronic interior condition. So for its symptoms and signs, the general symptoms and signs of internally generated dampness are as follows: nausea, loss of appetite, heaviness in limbs, fatigue, abdominal bloating, loose stools or diarrhea, increased vaginal discharge, cloudy urine, sticky taste in the mouth, lack of thirst, slippery pulse, and a thick and sticky tongue coating. So let's discuss further the symptoms and signs of specific internally generated dampness patterns. So first we have stomach and spleen dampness. This can manifest with poor appetite or no appetite in the morning. There's nausea, blocked or replete sensation in the epigastric region or abdomen. There's loose stools or diarrhea, sticky taste in the mouth, lack of thirst, loss of sense of taste, heaviness in the arms and legs, white, sticky discharge from the vagina, edema, fatigue, heaviness in the body and head, fuzzy thinking or feeling as if the head is full of cotton wool, dull, pale complexion, thick, white, sticky tongue coating on a pale tongue. In a chronic pattern, the coating may not be so thick and there is a slippery or slow pulse. In dampness in the intestines, there is diarrhea or loose stools that are watery and odorless. There's borborygmi, heavy, uncomfortable or repeat sensation in the abdominal cavity, abdominal bloating, nausea, vomiting, lack of thirst, thick, white, greasy coating on the tongue, and a slippery pulse, especially in the third position. In damp heat in the intestines, there is explosive diarrhea, sticky, odorous stools, burning sensation in the rectum. The stool may be bloody, and there is thirst without desire to drink. There's flatulence, odorous flatulence, dark urine, oily or sticky sweat, sticky yellowish tongue coating, raised red papillae on the root of the tongue, and the rapid and slippery pulse, especially in the third position. In dampness in the urinary bladder, there is turbid or oily urine, difficult or obstructed urination, frequent but scanty urination, heaviness, tightness, or obstructed sensations above the pubic bone, white, oily coating on the root of the tongue, slippery and tight pulse, especially in the left third position. In damp heat in the urinary bladder, there is a dark, cloudy, odorous urine. There may be blood in the urine, frequent scanty urination with burning sensation, yellowish and oily coating on the root of the tongue. There may be a raised red papillae on the root of the tongue, a rapid and slippery pulse, especially in the left third position. Next is dampness in the uterus. There is watery, whitish discharge from the vagina that is odorless or smells like fish. There's sticky white tongue coating in the root of the tongue, a slippery pulse, especially on the third positions. In invasion of damp heat in the uterus, there is yellowish, sticky discharge from the vagina that is very odorous and smells of leather. There may be vaginal itch and the mucosa may be red. There is sticky yellowish coating on the root of the tongue, a rapid and slippery pulse, especially in the third positions, and all symptoms and signs will be acute. In dampness in the liver, there is sore, painful or swollen genitalia, weeping sores on or itching in the genital region, hypochondriac region. There is vaginal discharge, difficult urination, impotence, sticky coating on the root of the tongue, the slippery or wiry pulse, and especially on the left guan position. In dampness in the gallbladder, there is costal pain, heaviness, nausea, sticky taste in the mouth, thick coating on the side of the tongue, a slippery or wiry pulse, especially on the left middle positions. In damp B, this is B syndrome in which dampness is the predominant pathogen. The pain will be heavy and dull, and there often will be numbness. There will usually be swelling around the joint, possibly also edema. The pain is never sharp and will usually have arisen gradually. The symptoms will be affected by humid climates and environments. There will be general sensation of fatigue and heaviness. The tongue can be wet with a thick, sticky coating, and the pulse will be slippery or soggy. In damp heat in the joints, there will often be several joints that are simultaneously affected. The joints will be sore, painful, swollen, and red, and will feel warm when palpated. The person will often have additional characteristic heat signs such as a red face, thirst, rapid pulse, and red tongue. And finally, dampness in the skin, there will be exuding skin disorders. Thank you for your attention.
Let's discuss diagnosis according to 6 stages. The Diagnostic accumulation of blood. This is the second of the 2 organ patterns that were differentiated by Sang-Sung Jing in the Taiyang stage. The combination of heat and the stagnation resulting from the presence of exogenous pathogenic qi can result in blood stagnating in the lower jiao and specifically in the urinary bladder. This is a deeper level than the previous pattern. The previous pattern will correspond to a qi level pattern in diagnosis according to the 4 levels, whereas this pattern will correspond to a blood level pattern. Blood stagnation will manifest with pain and discomfort in the area above the pubic bone. There will be difficult and painful urination. It can result in urgent urination. Both blood stagnation and heat can result in blood in the urine. Heat can also ascend to the heart, making the person restless and irritable. The presence of heat and blood stagnation will also be evident in the person's tongue and pulse. Etiology, invasion of wind and cold. For the symptoms and signs, there is painful, urgent, and difficult urination, blood in the urine, pain and discomfort in the area above the pubic bone. Mental restlessness, purple, red tongue that lacks coating, rapid and choppy pulse. Key symptoms, there is a painful, urgent, and difficult urination with blood in the urine, and there is a purple tongue. For the treatment principle, we have to spread qi and blood in the urinary bladder, drain heat from the urinary bladder. Acupuncture points, choose from REN 3, REN 9, liver 3, spleen 6, spleen 10, UB 17, UB 22, UB 39. Needle technique is draining. For the explanation, REN 3 and spleen 6 move blood and drain dampness from the urinary bladder. REN 9, UB 22, and UB 39 regulate the water passage and drain fluids. Spleen 10, UB 17 moves blood. Liver 3 regulates qi in the urinary bladder. Relevant advice, the person should avoid consuming substances that are hot in their energy, as this will create further heat. Taiyang Fu accumulation of blood can be caused by the following pattern of imbalance. Taiyang channel invasion. Taiyang Fu accumulation of blood can result in the following pattern of imbalance. Taiyang Fu accumulation of water. There are also combined Taiyang patterns. The most important of these are invasion of wind cold combined with the internal heat and invasion of wind cold combined with internal phlegm fluid, blocking the lungs. In both cases, there will be visible symptoms and signs of both patterns simultaneously. Thank you for your attention.
We discussed combining points, principles, the channel system dynamics. After identifying the patterns and formulating a plan of treatment, the next step for an acupuncturist is that of the selection of points to use. There are two different considerations: the selection of points according to their action, the combination of points according to channel dynamics. In other words, in order to give an effective acupuncture treatment, it is not enough to select the points according to their individual characteristics and energetic action. We must also be able to combine points harmoniously according to their action within the channel system. Acupuncture works via the channels, not just via isolated points, so that each point should be considered not only for its individual action, but also for its place within the channel system. Even if we master the action of each individual point, this is still not enough to give an effective acupuncture treatment, as each point must be seen not in isolation, but within the dynamics of the channel system, so as to attain a harmonious combination of points. For example, one might treat spleen qi deficiency and liver qi stagnation by tonifying bladder 20 and bladder 21 and reducing bladder 18 and bladder 19. Although technically correct from the point of view of energetic action of the individual points, it would be an unbalanced point prescription as all the points selected are on the back. To give another example, one might treat liver and kidney deficiency by tonifying kidney 3, liver 3, spleen 6, and kidney 6. Again, this would be correct according to the functions of the individual points, but also rather unbalanced as all the points are on the distal part of the legs. The balance of the point combination is essential to the success of an acupuncture treatment. Indeed, a balanced point combination is as important to the therapeutic result as the needling technique. The latter is, of course, very important to the success of an acupuncture treatment, but the harmonious combination of points is often overlooked. They are both important because they reflect two different viewpoints. In a way, the stress placed on needling technique is based on a point-centered view of acupuncture, while the stress placed on the combination of points is based on a channel-centered view of acupuncture. Both of these points of view are important and both need to be taken into account. So the stress placed on needling technique is based on a point-centered view of acupuncture, while the stress placed on the combination of points is based on a channel-centered view of acupuncture. Although the needling technique is indeed very important, we should not place too much stress on it. In fact, when the point combination is harmonious, we bring into play the circulation of qi in the channel system so that qi is moved effectively, somewhat reducing the need for vigorous needling manipulation. For example, stomach 40 is said to resolve phlegm, and in case of a severe phlegm pattern, we should needle this point with a reducing method. The more full the condition, the stronger the reducing technique required. However, resolving phlegm with acupuncture involves a lot more than simply reducing stomach 40. In particular, it involves regulating the qi mechanism by harmonizing the ascending, descending, and entering, exiting of qi. Acupuncture can resolve phlegm only by regulating qi. By combining stomach 40 with other points according to the principles outlined, the movement of qi is encouraged by the communication among the points rather than just by the stimulation of one point. The combination of points also regulates the ascending, descending, and entering, exiting of qi. For example, in order to resolve phlegm, stomach 40 could be combined with lung 7, ren 12, ren 9, bladder 22, and kidney 7. Apart from the fact that the other points also contribute to resolving phlegm, Such a combination balances yin with yang points as well as points on the arms with points on the legs. Thank you for listening.
Let's discuss large intestine deficient or empty code as we continue with our diagnosis according to zlmgfo organ patterns. The difference between this pattern and damp cold in the large intestine is that this is a deficiency pattern of imbalance, whereas damp cold in the large intestine is an excess pattern. The stools here will not be explosive and there will not be a cramping pain in the abdomen. Instead, the pain will be a dull, nagging pain that is not alleviated by the passing of a stool. So let's examine its etiology. This pattern can arise due to excessive consumption of food and beverages that are cold or cooling, both energetically and thermally, or from prolonged exposure to climatic cold and repeated invasions of exogenous damp cold. Physical and sexual overexertion can also be involved in the generation of the underlying yang deficiency patterns. So for its symptoms and signs, there are unformed stools, dull, nagging, or gnawing pain in the abdomen that is not alleviated by passing of stools. There is borborygmi, frequent urination with a large quantity of pale urine. The skin of the abdomen feels cold on palpation. The abdomen does not feel tense or hard on palpation. There are cold limbs, pale tongue, a deep and weak pulse, and the key symptoms here are unformed stools, deep and weak pulse. For the treatment principle, we warm and tonify the large intestine. So for the acupuncture points, you can choose from stomach 25, stomach 36, stomach 37, spleen 4, REN 6, and UB 25. We use the tonifying needling technique, and moxa is also recommended. So for further explanation on the choice of points, stomach 25, stomach 36, stomach 37, spleen 4, and UB 35 warm and tonify the large intestine. REN 6 warms and tonifies yang. So when there is large intestine empty cold, it is beneficial to consume warm, cooked, or baked food. It is advisable to eat food that have a warming energy. Baked root vegetables, stews, soups, lamb, chicken, onions, and leeks are all examples of warming food. Spices that will be beneficial are cloves, cinnamon, ginger, basil, rosemary, and nutmeg. Large intestine deficient or empty cold can be caused by the following patterns of imbalance: spleen yang deficiency and kidney yang deficiency. In turn, it can result to damp cold in the large intestine. So to summarize, large intestine deficiency cold has its etiology in excessive consumption of cold and raw foods, prolonged exposure of the abdomen to cold weather, probable underlying spleen or kidney yang deficiency. Possible presenting conditions, chronic enteritis, and chronic dysentery. Signs and symptoms: there will be loose stools resembling duck droppings, dull abdominal pain, pale urination, cold limbs, borborygmi, lower backache, poor appetite, and aversion to cold. In comparison, in spleen stomach yang deficiency, the stool will contain undigested food. There is poor appetite and oppression in the abdomen after eating. In large intestine yang deficiency, the disease is in the lower rather than the middle burner, accompanied by diarrhea and borborygmi, and may have constipation rather than diarrhea. So the pulse atmosphere is deep and weak. The tongue is pale, thin, and with thin coating. Treatment principle, we stop the diarrhea and supplement qi and yang. For the acupuncture treatment, so we can needle stomach 25 to stop diarrhea and pain, stomach 36 to supplement spleen qi, bladder 20 to supplement spleen qi, Ren 12 to fortify the spleen, Ren 6 to supplement qi and stop chronic diarrhea, stomach 57 to stop chronic diarrhea, liver 13 to transform stasis, bladder 25 to supplement the large intestine. And we needle with supplementation and moxa. Thank you for listening.
Let's discuss diagnosis according to 8 principles, excess conditions. Excess conditions are characterized by the presence of pathogenic qi in the body. Pathogenic qi will either be exogenous or internally generated. Furthermore, stagnation conditions are also defined as being excess conditions. The body's same qi is theoretically intact in an excess condition. In practice, though an excess condition can be such a burden on a person's same qi that it will often develop into combined deficient and excess conditions. Excess conditions can also rise from deficient conditions. This will therefore also be defined as being deficient excess conditions. Excess conditions that are caused by invasion of exogenous pathogenic qi will be acute, whereas internally generated pathogenic qi is usually more chronic in its nature. Even though a condition is chronic, it can still flare up with acute symptoms. The symptoms and signs seen in excess conditions tend to be more intense than those seen in deficient conditions, which tend to be milder. For example, vomiting in excess condition is often explosive, whereas regurgitation is more typical in deficient conditions. If there is pain or discomfort, they will be more extreme. The pain will not be alleviated by palpation in local area, but will usually be better with movement. The voice of a person with excess condition will be louder than if there is a deficient condition. There is also less likelihood of fatigue. A person may feel fatigue when there is a stagnation conditions, but this is a spurious form of fatigue. The fatigue that the person experiences is due to their qi not circulating around the body. When there is spurious fatigue, the person will usually feel pressure and more energetic after physical activity. The pulse will be powerful and the tongue will often have a thicker coating when there is excess condition. Excess conditions will often generate blood heat, pathogenic heat in the body. This means that signs such as red face, irritability, rough breathing, and constipation are often in general, though it can be difficult to generalize how excess condition will manifest. This is because there is so much variation in the types of pathogenic qi that can be excessive. Excess conditions can be summarized as follows: invasion of exogenous pathogenic qi, interior cold, interior heat, interior wind, ascending yang, dampness, phlegm, qi stagnation, accumulation of fluids, and blood stagnation. For the etiology, excess condition arises when the body is invaded by exogenous pathogenic qi, when there is internally generated pathogenic qi, or when there is a stagnation. For the symptoms and signs, symptoms that are acute, chronic symptoms can, though sometimes also be excess in nature. Intense or severe symptoms, pain or discomfort that is not relieved by palpation, symptoms that are relieved by activity and movement. Loud voice, heavy breathing, full pulse, thick coating on the tongue. Treatment principle is to expel, drain, or transform pathogenic qi, spread or dissolve stagnations. Thank you for your attention.
Let's discuss kidney yang deficiency as a pattern for depression. Kidney yang deficiency will manifest, aside from depression, with exhaustion, does not want to do anything or go out, weariness, chilliness with desire to curl up, sore back, frequent urination, pale urine, no willpower, no initiative, lack of drive and determination, tongue very pale and wet, pulse weak, deep, and slow. The kidneys house the willpower. Willpower as a translation of sure includes willpower itself, drive, determination, steadfastness, and physical and mental power. As yang implies activity and movements towards the outside, in this pattern of kidney yang deficiency, there is a definite lack of drive, determination, and initiative. The person is deeply depressed, lacks enthusiasm, and is unable to find the drive to do anything. Depression occurring against a background of kidney yang deficiency is particularly characterized by a weakness of the kidney's willpower, or qi, and therefore lack of drive and initiative. The pattern of kidney yang deficiency is more common in middle-aged patients. It is due to worry, sadness, grief, or fear. Treatment principle: tonify and warm the kidneys. Points: kidney 7, kidney 3, ren 4, do 4, bladder 23, bladder 52, bladder 47, do 20. All points are needled with reinforcing method. Moxa should be used. Kidney 7 tonifies kidney yang. Kidney 3, source point, tonifies kidneys. Ren 4 with moxa cones tonifies kidney yang and the original qi. Do 4 tonifies kidney yang and warms the fire of the gate of life. Bladder 23 tonifies kidney yang. Bladder 52 and bladder 47 in combination strengthen drive, determination, and willpower, and stimulate the coming and going of the ethereal soul. Do 20 lifts mood. Thank you for your attention.